There we go. All right, careers in allied health. I'm gonna stop sharing my screen so we can see our lovely panelists. Go. Get to, oops. First question. So just really briefly, I'm going to ask our panelists to tell us a little bit more about who you are, what you do, the nature of your organization or the job that you do. I will ask, just so we don't all jump up and talk at once, I'll ask Alexandra to start if she doesn't mind.
Hi, everyone. My name is Alexandra May. I am a University of Maryland 2015 graduate. Go Terps, the best 4 years ever. So enjoy college and everything that it has to offer. After going to Maryland, I went to nursing school. So during my senior year public health class with Dr. Howard, I'm not sure if you guys have taken her, but she had a public health class where a nurse practitioner came in and spoke about how she lowered the infant mortality rate. And from then, I really drew an interest towards nursing. So I knew after I graduated from nursing school that graduated from University of Maryland, that I definitely wanted to go to nursing school. So I started nursing school soon after graduation from Maryland. And then I graduated from nursing school in 2018. And I'm currently working as a cardiac catheterization nurse. So that basically means when people come in with heart attacks, we open up their arteries and allow blood flow to go to the heart and all the other organs. So sometimes it's a very intense job, but my education has definitely prepared me and I really enjoy what I do. When I'm not working as a nurse, I'm advocating for self-care for healthcare professionals, especially nurses, because it is easy to get lost in the world of helping others. And I strongly believe that self-care is not selfish and that we always have to take care of ourselves and make sure that our own cup is filled before we pour into others. So thank you guys for having me. I'm very excited to be here and be back with my fellow home. I miss you guys.
That's awesome. I love that. Thanks so much. Brandon, why don't you take the next one?
Certainly. Thank you. Thanks, Alexandra, for kicking it off. I feel like there is so many things that I identify with what you said. First off, I'm also a fellow Terps alum. I graduated in 2011 from University of Maryland College of Pharmacy. I was a biology major in college. I was very involved in the pre-pharmacy society that hopefully is still in existence there. I kind of knew early on that pharmacy was where I wanted to go. I had actually started out working as my first job as a cashier in a grocery store. And I was thinking, what am I going to major when I get ready to go to college? And, there was a pharmacy there. I started working there and that really got my interest. I was really interested in health and fitness. And then that spun off to pharmacy and practicing and continued on through University of Maryland College Park, graduated from there. I want to say it was my senior year. Yes, it was my senior year. I applied to the pharmacy school that I went to, got accepted to, which is University of Maryland School of Pharmacy, where I am now in Baltimore. And then I graduated from there in 2015. I did a 1-year community pharmacy residency at Johns Hopkins Home Care Group, which is here in Baltimore. And then I stayed on and now I'm a clinical coordinator for solid organ transplant. So really what that means is anybody at our hospital who receives a new solid organ, which is going to be a kidney, liver, pancreas, heart, or lung, whenever you're transplanted, you're put on all these new medications. So immunosuppression or anti-rejection medicines. You're put on a host of anti-infection medicines. And my job is to make sure that, most patients have never been on that many medications before. They don't know what they're for, side effects, how to take them. So it's my job to make sure, they're educated on that, but also, things like insurance barriers or, pill burden. We make sure to talk to all of our patients, make sure they can afford their medications before they go. And one last thing, when Alexandra said something about you have to make sure that you pour into your cup before you can pour into others, that's absolutely true. I think we've been talking about it a lot, just given, all of the turmoil and things that have been happening, with the different racial events currently. We've really been talking to a lot of our mentees about making sure that you take care of yourself, that if there's anything going on in your personal life with, just emotionally, physically, that you make sure to not neglect yourself, because patient care can be taxing. So we definitely want you to keep that as a priority.
Awesome. Thank you. And then last but not least, Diana.
Hi, everybody. I'm Diana. Just to piggyback off of what the other two panelists said, you definitely need to take care of yourself, especially working in healthcare, because there is a high burnout rate and it gets really, really stressful. But that's my 2 cents on that. I also graduated from Maryland in 2014. I was a kinesiology major. I started as a nutrition major, and then I transferred to kinesiology because I knew I wanted to do physical therapy. I was part of the pre-physical therapy group. It wasn't that active back then, so hopefully it's more involved now and more members are in that group. But I knew I wanted to do physical therapy because I was always active. I always played sports. I tore my ACL in actually my senior year of college. So that was really hard because I had to walk from like SPH building all the way to Susquehanna with a messed up knee. And so I had physical therapy and it was super fun. I was in a sports physical therapy clinic and it just confirmed that I wanted to do or pursue this as my career. So I took a gap year after I graduated in 2014 and I didn't start PT school until 2015. I went to the University of Maryland, Eastern Shore, and I graduated in 2018. Right now I work for MedStar Health. I live in Virginia now, so I'm no longer in Maryland. But they do have plenty of offices and clinics in Maryland. They have their main hospital in DC, and they have a ton of other hospitals, mainly in Maryland, actually. What I like to do on my free time for self-care is I lift a lot, as in like I'm an avid gym goer. I do powerlifting. If anybody's interested in that, we could talk more about it. I work in a general outpatient orthopedic clinic, but I really want to get more into sports. And I am recently have decided to start looking into cash-based clinics, which means the patient will come to you with direct access. They don't have to go to a doctor, but they will use their own money and pay out of pocket and not have to go through insurance directly, because there are a lot of restrictions with treating under insurance. So that's that.
Awesome. Thank you all for introducing yourself and telling us a little bit about what you do. I'm going to add all of our panelists now to the spotlight so we can see everybody. Next question. What advice do you have for a student seeking to gain experience in this field? It could be like what specific hiring strategies, whether that's networking or joining professional associations. But what specific hiring strategies would you say were helpful either for you or would be helpful for our students to be aware of?
I found that prior to knowing that I wanted to be a nurse for sure, that having internships, specifically the summer medical and dental education program, you apply to it your sophomore year of college, either sophomore or junior year. I was able to shadow physicians. And from there, I realized I didn't want to be a physician and that I would rather work with nurses. So it was nice to kind of find different internships where you can get a glimpse of what you think you want to do. So before you make that full on time commitment, you kind of have an idea of this is the path that I want to take. So that helped. A lot of people who were in nursing school with me, they were nursing assistants or patient care techs. So you're able to work directly with the patients on the floors and you're able to figure out, hey, do I like what the nurses are doing? Can I see myself doing this? And also gain different networking opportunities to talk to the physicians while you're there, the nursing staff and everybody. And I think ultimately the best thing that's helped me is joining professional organizations. So throughout nursing school, I was in New Jersey Nursing Students Incorporated, and at Maryland, I was in the Pre-Nursing Society. So with that, we were able to go and different forums that had to do with nursing, network with nurses at University of Maryland, their Baltimore campus, and just get a glimpse of firsthand experiences. So they had panelists come in, we met right on campus, and it really helps you network with other people at Maryland who want to go to nursing school as well, or who are interested in nursing. So you guys can understand the application process, what's required, and other people going through the same thing. So I think those were the three biggest things that helped, just having the ability to shadow, having direct care experience. I never worked specifically as a nursing assistant, but people who have, they said that it's been helpful. And lastly, joining organizations on campus. Even if it's the Charles R. Drew Pre-Med Society, pre-med and nursing, they kind of go hand in hand in terms of the healthcare field. And Charles R. Drew wasn't always all just medicine, physician-wise. So it was an opportunity to get a glimpse of the healthcare field. And I think that really helped.
Yeah, I agree. Oh, I don't know if this is. Yeah, I agree that you definitely need to gain experience within the field, and especially in different settings. So like if you want to do pre-med, you got to know what specialty you want to do. And same with, I assume, pharmacy and with nursing, but with physical therapy as well. There's so many different settings. You can hate one setting but love another. So it's important that you open your eyes out to what there is out there, and also help with networking for sure. The more you network, the better insight you'll get with what you want to do, and the more you'll see who you want to work with.
I agree with all that. I would say the training programs for sure. So internships, residencies, those can all really help to kind of give you an idea of what you're getting yourself into, whether or not you will like that particular field. And also every health system or every company, business, practice site is different. So, you know, from one hospital to the next, from one retail setting to the next, it's all very different. The culture is different. That's one thing that I've learned in the last couple of years of working is, you know, you really need to understand the culture of your organization and how do they embrace change and how do they embrace new ideas? How is it collaborating with other disciplines? Where, you know, one thing that I didn't know when I was interested in pharmacy, I started out, I had a limited experience just in my work experience and working in the retail setting. And so I'm thinking, you know, probably the people that I will interact with the most is probably just only patients, where now I would say I probably interact a lot more with social workers, a lot more with nurse practitioners, which has really added a lot of fulfillment to my job. So I think just knowing what's out there, what's available, it might open you up to a particular profession that maybe you thought was just one particular way. I also agree with what the other two panelists said in regards to networking. I think that's a big one. I ended up getting into my position because of the residency route, matching into the residency and then staying on and being fortunate there was a position open for me. I will say that I have been able to pull in two pharmacists. One pharmacist was actually my really good friend from pharmacy school. And, you know, he was very good in his role. He was working at a different company. I knew that he was looking to make a transition in practice site. So, you know, because I had been in the organization for a couple of years, I knew who the people in HR were. I knew the hiring managers. And so I was able to put in a good word and get his resume pulled. A lot of times, you know, people from the inside can help you out. And very similar to another individual we just pulled in. I'll be honest, I actually didn't know her that well, but because we have a mutual friend, a very good friend of mine that I went to University of Maryland at College Park, I kind of went out on a limb for her and helped pull her in. So it really is who you know. I mean, I've heard it so much, you know, from starting out. It's not what you know, it's who you know. But, you know, really forming those relationships, and you never really know when they might come in handy or when you might need them. But sometimes things pull through, and it just so happened that one of her good friends is one of my best friends. And so I was happy to help her just based off of that. So, you know, just be good to people and it'll come back your way.
Awesome. Thanks so much. So COVID's a thing right now. How has your field been affected? Because I imagine there's no way it hasn't been. We all have been, right? And then would your advice for finding internships or jobs be different given the pandemic and how that could be changing your jobs and whether you can have interns or people shadow you or, you know, opportunities that might have helped you eventually get to where you are?
So for physical therapy, it definitely has had its effect. I know a lot of people have gotten furloughed from their job because the patient volume was low. I know some clinical affiliations from PT school, so PT students would have to, their clinicals were canceled pretty much, so their graduation was postponed if they were supposed to graduate this year because it's a requirement to have these hours in school. But it's bounced back pretty quickly. I think it was just a couple months where, at least my clinic did, but a couple months it was kind of slow, and we've transitioned to telehealth. So that was pretty new, and I think it was new for a lot of people. But I think what you really want to look for in a company that you work for, and I think this goes for any company, is like how do they treat their employees during COVID? Like, are they providing masks? Are they providing, at least the bare minimum? And also, like, in terms of marketing too, like for me, I had to start marketing even more to get more patients in, which means talking to people, calling gyms, and talking to schools. So it's definitely had a negative impact initially, but I think the profession has definitely adapted, at least for outpatient. I can't really speak for inpatient in the hospital setting.
For me, COVID has allowed people to see nurses in a different light. Always before it was like, okay, you're just a doctor's helper, this and that, or just a nurse. So it's nice that 2020 is the year of a nurse and that we're able to kind of like be seen in a different light, like we're actually helping in a way where people didn't understand, being on the front lines, being those first line responders. Interesting. I work on a cardiac unit doing surgery. So cardiac cath is surgical. You have to be sterile, draped up, so no one gets infections. So during the peak of COVID, we actually shut down the unit only for emergency. So someone's having an emergent heart attack, then we opened it up. But while that was happening, we had to float to other areas, other places within the hospital who needed us, and we got deployed to different places. So with that being said, it kind of changed the whole what you expected, like the whole day-to-day life of nursing, because you were shifted to different units, you had to take on new roles, new responsibilities. So it was very different. It definitely made me aware and even hone even more. Self-care is not selfish, because usually when someone is having a heart attack or can't breathe in a code blue, your first reaction is to run in the room. Let's go help. But this time you need a mask. You need to keep yourself protected. You need to get everything situated so you're not getting sick and not able to help anybody else or help yourself. So I think it's been a change, but definitely helped us see the importance of taking care of ourselves and the importance of all the frontline staff between nursing, physicians, techs, physical therapy, OT, pharmacy. Everybody came together. The cleaning staff, we all needed each other. So it was nice to see the collaboration between that. In terms of volunteering right now, we're not offering a lot of volunteer opportunities within the hospital because there's so many restrictions right now with COVID. But I believe as time goes on and the months go on, there's going to be more opportunities to be able to be one-on-one. It's hard to shadow directly on nursing units at my hospital because of legalities, but usually we have nursing students who come and shadow us. But I would say the summer internships would be the best help in terms of finding a program that's structured where you can shadow a nurse and figure out if you like what she's doing on a day-to-day.
Yeah, I would say for us in pharmacy, with COVID, a lot has changed in terms of, depending on what your role is. So for me, prior to COVID, my role was really going into patients' rooms. So I primarily interacted with patients that were admitted to the hospital after their surgery and talking through the medications with them before they were to get discharged. Well, our patients are immunocompromised. When you get the transplant, they have to give you a ton of medications to basically lower your immune system, which puts you at risk for infection. So you would be at a greater risk for infection from COVID-19. So even more so out of concern for the patients, out of concern for the transplant pharmacists like myself, who would usually be spending 45 to 60 minutes in the patient's rooms doing their education. We changed everything, I want to say, within 48 hours. Our transplant patients were moved to another unit in the hospital. The old transplant unit turned into a COVID unit. We had to figure out how we were going to make sure that we were still educating them, still able to, have them practice with their blood sugar testing supplies, filling their pill box. So we ended up actually converting to Zoom. So I'm very familiar with Zoom after the last 6 months of, leading a lot of the education sessions. So that was, kind of a learning curve for us, just to make sure everybody knows how to get logged on, and not only the patients in their hospital rooms, and sometimes I'm at home, sometimes I'm at the hospital. Also caregivers who are wherever. A lot of caregivers have not been allowed to come into the hospital because there's concern they could be bringing COVID. They might be a carrier and not knowing it. So kind of working through all those has been a challenge, but I'll say we have had success because of the increase in using telemedicine like Zoom, like other platforms. It has allowed a lot of patients to have more family members, more caregivers that maybe previously, even though they were allowed to come to the hospital, they weren't able to make it in. That has been a positive that we've seen. We've had a lot more engagement, a lot more support for the patients.
Wonderful, wonderful. And just a reminder, I know I put this into the chat, but if you have questions that you'd like to ask our panelists, please feel free to send that to Lauren Meyer in the chat. I do have enough questions, but I'd rather make sure that we're answering the questions of those that are attending. And I understand that we have one, right, Lauren?
That's correct. We have a few actually.
Awesome.
But I will start out with one that's a little bit more general and really on topic with what all of our panelists have been sharing about, that importance of self-care and focus on your mental health so that you can be best prepared to, provide that care for others. So one of our students has asked, when you first started out directly working with patients, what are some of the things that you did mentally and emotionally to kind of help prepare and sustain yourself?
So I have one idea, and I think it's because Diana actually gave it to me. She mentioned she's an avid lifter. You mentioned powerlifting. I'm very big into the gym. That's something that I picked up super early on. I want to say end of high school, beginning of college, and continued on through pharmacy school. And so just having a passion outside of work. It's something that I do every morning. A lot of my friends think I'm crazy, but I'll get up and I'll be at the gym at 5 or 6 o'clock in the morning. And something about that session before I go into work, it just, energizes me. It gives me energy to be able to pour into somebody else, to be able to go the extra mile, work up my patients, make sure that, any barriers I've taken care of ahead of time, and really given that energy. So usually before I go into a patient's room, if I don't already have that energy, I also drink coffee too. So I try to go in and, and happy, and try to picture it like, let me think about that, usually like for my profession, the medications can be overwhelming. A lot of people, are nervous about costs. They're nervous about, am I gonna die if I miss a dose? Like, different things like that. So I try to go in and, say like, I'm here to give you a manageable regimen. I'm not trying to, ruin your life with all these new medications, but I'm really here to educate and empower you. And, this can be fun, and we can personalize it for you. And I try to picture, what would I want if I was, maybe not in the best state, or I was in a state of recovery and I was, trying to get better. And just, it's not just sometimes what you say, it's sometimes like how you say it, how you deliver it. And when you give that positive energy, that's what people remember. And they feel like, okay, I've got it. I'm going to be fine. Like, and I also have, Diana, or I have Alexandra, somebody who's looking out for me, and they're confident that I can do it too.
Yeah, I totally agree. And I think as healthcare professionals, there should be a passion or, a drive to want to be healthy. So that's why I'm very into the gym, and I have been for a long time. But just like what Brandon said, like, it's important that you have that positive vibe, because that's what they're going to remember. And also sometimes these people are miserable, whether or not they're sick or they're in a lot of pain. And so if you just, I don't want to say this advice like fake it till you make it, if you're having a bad day, just smile and have positive vibes. It really changes their life, and it really changes their perspective. And you can see like a quick turnaround right away from when you first saw the patient to the end of the visit. because they see that they have such a positive provider, somebody that they could trust. Another thing that I did to prepare for when I first started was talk to people that have been in the profession for a long time. So a big thing is like when you first start, you feel like you don't know anything, but then you actually know a lot more. Like school has prepared you like more than you thought. And so just having that confidence, and if you don't have enough confidence, then you should prepare the day before, look at your patient caseload, or, just have an expectation of what you're going to see. It's going to change possibly, or probably it's going to change because things happen all the time. Just be prepared and be confident, and also have a hobby, have a hobby outside of work so you can take your mind off and ground yourself.
I too enjoy running and working out. Initially, when I started, yes, initially when I started, I was like, I don't have time. How am I going to fit it in? But my preceptor, I was so blessed to have her. She's like, you have to make time. So she would be at the gym after a long shift. And I'm like, okay, let me go with her. So that's how I realized I needed to work it into my schedule and put it in as though it was a task or an assignment, because virtually every day I could be a little bit tired or more tired than usual. So if I didn't set it into my schedule, I would let it go. And then 2 days becomes 3, becomes a week, becomes 2. Now I haven't run or done anything like relatively productive health wise. So I found that actually fitting it into my schedule really helps in terms of exercising and figuring out how to get my zen back. Also, I'm a crier at times. If something happens with my patient and it really affected me, I'll handle it at the time, keep my face, composure, but go to the bathroom. And when I need to cry, I cry. You're dealing with people's lives, life and death. It can be very scary at times. At the end of the day, as much as I would like to control situations, I don't. So I realized when I need to take a step back and say, hold on, I need a break. Can someone relieve me? And also taking my breaks. Some people want to just work throughout the whole time and say, I'll take a break later. Please take your water breaks, whether it is in school or not, just in general. Take time to take your water breaks, bathroom breaks, and just getting fresh air. Because I realized when I came back from those breaks, I felt way better than just trying to push through a whole shift. And creating a routine. I found that meditation has been a thing that has helped me, and it's an ongoing process. Initially, I thought meditation was just sitting there trying to get my mind completely free of all my thoughts. But then I did a few classes and then just kind of sat with myself and figured out where I was at that time, gave myself some grace, and have learned how to really hone meditation skills and figure out what's best for me. So I do that in the morning before I go to work and in the evening when I come home. Doing it in the morning before I go to work helps me and prevents me from just rolling out the bed and rolling into work. That was becoming a habit. I'd be tired at night, wake up in the morning, go straight to work. For me, I realized that's not a good way to start my day, because I needed a kind of this is a new day. This is how I'm starting it. I feel prepared, refreshed. So just finding a way to deal with yourself in a way that fits you. What works for me may not work for you, but I found that as I'm learning myself, I can find those things that work, whether it is running for the day. And sometimes self-care is just rest. When I need nap and just Netflix, then I know I just need naps and Netflix. So just finding what works for me.
Love that. Thank you, everyone, for offering those perspectives. I'm really quickly going to focus in on, Brandon, we had a question specifically for you, just kind of touching on the kind of job growth rate in pharmacy, and what are kind of your thoughts or your perspectives on that? And kind of specifically, would you recommend doing a residency?
That's a great question. Thank you, Lauren. So I want to say the job growth in pharmacy has been an interesting topic. When I was first in high school and in college, I think pharmacy was maybe one of the top 10 jobs. I know because I believe my parents got me a book, it was like the top 10 careers we were thinking about. What are you going to do with your life? So, I was already interested in pharmacy, so that worked out great for me. And I want to say by the time that I finished college and was getting ready to go into pharmacy school, it actually started to decline. So previously, pharmacy was such a hot market and they needed so many pharmacists. Pharmacies were opening up, pharmacy schools were opening up. And it was to the point that when you graduated pharmacy school, you know, you were hearing people were getting these huge signing bonuses, they were getting cars, you know, it was the profession to go to. Pharmacy has gotten pretty saturated, not to deter you, but pharmacy has gotten saturated. And I think recently with the economy, there has been some things that that has made it more challenging for those that are in the pharmacy profession. I would still definitely recommend it for several reasons. One, I'm very fulfilled in what I do. I think a lot of that has to do with me pursuing postgraduate training, which was that residency program. I would highly recommend if it matches your career goals and it matches your passion, because I think you have to be passionate in whatever you do. I think you need to be passionate to get through the residency program. I would recommend it because one of the things that I was concerned about, you know, not just in pharmacy, but any profession, is long-term success, long-term happiness. So you can get out there, you can start making, you know, whatever your desired salary is, and you think that that's going to keep you happy, but then you end up hating your job. And, you know, for me, you might have loans to pay. That's not going to keep you happy. You want to make sure that you're going to have a good quality of life at work and also outside of work. So that was super important to me. And so I really tried to think in my mind when I was, you know, in my early 20s. And then when I graduated pharmacy school, I was 25. I started thinking, you know, how am I going to be able to sustain in this career? I may be able to hustle really hard and do this at 28. How am I going to feel at 48? How am I going to feel at 58? Because I'm still going to have to work. So when you think of it like that and you think, okay, I may not be as energetic, my patience might not be that great. You know, I just started thinking about maybe I should really, you know, put in that extra work now, kind of hold off, don't go straight out and take that, you know, super attractive dollar amount offer that maybe is on the table. Maybe I invest in myself another year, another 2 years in a fellowship or in a residency. And I can say for me, as well as all of my classmates and friends who have done that following pharmacy school, we've all been very happy in our positions. We all feel that we have great job security, which is one of the things that either one of the panelists or you all have mentioned. We have seen, you know, certain companies, you know, within the pharmacy profession furlough. And I'll say for me, I feel that I have good job security. You know, that's one thing that we've talked a lot about at work. And I think the more specialized, or kind of tweak that a little bit, depending on your specialty field and depending on your skill set, the more advanced your skill set is, the more jobs it allows you to be able to apply to. And I think you're in a better situation for where you can go, you know, and who you're connected to in terms of job opportunities. So I would still very much recommend pharmacy as well as completing a residency.
Great, thanks, Brandon. Piggybacking on that a little bit, so we can include the other two as well. You mentioned, you know, kind of taking that time to invest in yourself and maybe avoiding that, you know, salary right away and doing the residency. What that might be perceived as a potential risk. What is the biggest, or what is one of the biggest risks that you have taken in your career? I'll throw that out to all three of you.
I think Brandon's point, just going back on what he said about not necessarily accepting the first dollar amount and really trying to figure out like chestnut checkers, is important, because I know right now the stress levels that I'm under at times, I don't think this is a sustainable specialty that I can be in when I'm 40, 50, 60. So I'm currently in a master's program at Drexel University for leadership and health systems management. So my overall goal is to be a chief nursing officer and kind of lead the hospital. So just when you guys are looking at different opportunities, take your time to really realize what you are aligned with, and not just necessarily jump out of fear or trying to do it just because I need a job right now. Looking at it strategically and giving yourself a set time to say, okay, if I get a job by this time, this is what I want, how am I going to work it? Because you don't want to necessarily be doing something years from now that you don't want to do and that you could have worked before to get to where you want to be. So I thought that was a great point, because a lot of times I feel like our society pushes us to just rush, jump, get it, go for it, without necessarily figuring out if that's what's best for me. But to answer your question about the biggest risk, my biggest risk was actually in taking this new job in January. I'm a relatively new grad nurse. I was a nurse for 14 months when the director of the cath lab asked me if I would want to apply to the position. And cath lab is critical care, high specialty. And I was like, no, I don't want to leave because I'm going to hurt my manager's feelings. And he looked at me and was like, okay, are you sure? I'm like, no, I can't leave because I just got to my first unit. He was like, why don't you think about it, give it a few days and get back to me. So I spoke it over with my family, and they were like, Alexandra, when you have new opportunities, like really pray on it. But if it's something that's meant to be, go for it. And people who want to see you grow, they won't be mad at you. And even if a leader is quote unquote mad or upset that you're leaving, that has nothing to do with you because you're here to grow, fulfill your purpose, and contribute to the field. So I definitely did not expect to leave my current unit and to be in the cath lab where I have nurses who have been there for 10, 15 years. So it was a big risk in learning to be more confident in myself and know that I am smart and intelligent and can contribute just as much as everybody else. And also know that I have a lot to learn as well. Nursing, no matter what specialty you're in, and anything in the healthcare field actually, is lifelong learning. Most specialties have to get continuing education credits, and you have to constantly be on the know about what's going on in your field so you can be a better practitioner for your patients, because everything's constantly evolving and changing, and we want to make sure that we are giving the best care to the patients that we can, depending on what new information comes out. So I would say the biggest risk was really leaving my old position and starting in the cath lab, which I love. I'm learning so much. It's definitely stressful at times and a huge adrenaline rush, but it's a blessing to know that I can help somebody and open up an artery right away and literally see somebody go from life to death. From death to life within a few minutes. And we can't save everybody. So that's another humbling experience too. Some people do pass away when they're with you. So it also teaches me how precious life is and how important it is to enjoy every moment.
So my experience is a little bit different because I am not in the hospital, but I'd say the biggest risk I'm taking is probably right now. I have a very stable job. I didn't get furloughed or anything, and I was pretty busy during COVID. I always had something to do, or my employer always had something for me to do. But the risk right now is what I mentioned before, going cash based. So right now it's starting as a side hustle, and it's getting a little bit more popular or trendier. But the reason why it's a risk is because, people who's gonna, the thought is who's gonna pay X amount of dollars when they could just go through their health insurance. But it's been shown to be successful. There's a lot of successful cash-based companies out there. So also getting out of my comfort zone and learning about business, that's a huge risk. And there's a whole business side of healthcare, which is a good and bad thing. But yeah, just jumping into that field and learning that way as well. And in addition, just piggybacking off of what Alexandra said, like changing careers or not changing careers, but changing jobs, changing positions. So if you're not happy somewhere, but you have a really, really stable job, changing jobs is really hard. So I'm in the process of that too. And it really depends, like Brandon said, the dollar amount is really attractive, but if you're not happy where you are and you could be happy somewhere else, you really have to weigh out the pros and the cons. And it's definitely not worth the dollar amount if you're already feeling burnt out like 2 years out of school. So it's really important that you put your happiness first. You can definitely be happy in healthcare if it's busy, if you're working with the population you want to work with. So, and if you're also growing and learning.
Thank you so much for sharing those. One of our students wanted to know how often you had the opportunity to shadow professionals in their fields before getting to work in the fields that you're in. So that might be while you were in your professional schools, or maybe even shadowing that you did as undergrads.
I will say for me in pharmacy, I had a lot more opportunity to shadow people in the profession of pharmacy throughout school. We have um, we have required rotations. I think most allied health professions have those required rotations. So I would say probably in my last year of pharmacy school, it's basically all rotations, and we have certain required ones that are community-based, health system-based, acute care, inpatient, long-term care. We had a rotation where we were assigned an elderly person, and we were to help manage their medications and identify any medications that would put them at high risk for falls. So you have like different specific rotations or learning experiences that are like 5 or 6 weeks, and you have several of those throughout the last year of pharmacy school that really helps to expose you to different practice settings. And then also if you got a part-time job throughout school, that's a great way to do it too. So being an intern or a technician is a great way to get on the inside and then talk to people that you meet and ask them, if you can't already see, like, what do you do? So I would usually set up, ask, could I have 30 minutes of your time to talk about your job and how you got to where you are? And would you recommend that I, be interested in your role? And how does somebody go about getting into your role? I think those are all things that will serve you well. I tell all of my mentees, really reach out to a lot of people to try to get a feel for what it is that you want to do. Because I think the earlier that you start, the better, because once you determine what direction or what route that you want to go, that can help to, identify what are the specific experiences that you want to help make yourself marketable. I think that's a huge thing that we don't all, at least I don't think I learned as much about it in school formally, is how to market yourself. So, at University of Maryland College Park, there's a lot of, professional student organizations, or, there might be specific courses that you could be interested in. Well, a lot of us who sit on the admissions committees, we're looking at that. So I participate in employee interviews, resident interviews. And so, also knowing that piece too, a couple years out from when you're going to apply can really help.
So to apply to PT school, you need hours. Different schools require a different amount of hours. So if you want to shadow somebody, you have to in order to apply. But if you want to shadow somebody, find a place that looks like something you like to do and just reach out to the owner. They usually have their email on their website. And yeah, that's where you could start making your connection. Also for PT school, you have to have hours in different settings. So making sure you have some in outpatient and some in inpatient, or pediatrics or neuro, or whatever you want to do. It's important to get those hours, not just for the requirements, but also, again, to see what you enjoy doing and what you don't enjoy working with.
I would say I spent the one summer doing the health professions program, and that allowed me to shadow both physicians and nurses. But the biggest time that I spent shadowing people clinically was actually during nursing school. So it was unique in that I didn't know I wanted to be in nursing school until senior year at University of Maryland. So I didn't have that much time to reach out to many nurses or shadow them. So I really utilized nursing school and our clinical experience to have the opportunity to see what they do. And as I went throughout my program, see if I truly liked it and resonated with it. A few people in my program realized at the very beginning this is not what they wanted to do, and they found other paths. So I think kind of knowing yourself throughout and staying true to yourself. And if you are doing it and you realize this is not for me, then not just pushing through and suffering through it just because you'll probably find something that will bring a spark out in you. Because I truly enjoy nursing, and hearing from the other panelists, like they truly enjoy their careers as well. So finding that place or that opportunity, that job position that resonates with you as you're going through it, if you realize after you start doing it that you don't really like it. But really clinically shadowing during school helped a lot for me to see if I wanted to be a nurse and what they did.
Alexandra, you perfectly set me up for the next question, because you kind of talked about like finding out if you like things or not. What are some reasons a person may not be the best fit for a prospective career field or for your fields? Are there specific strengths or skills that they would definitely need to be successful, or are there things that if they don't like it, they wouldn't be successful?
I would say, within the first few months of either clinicals at nursing school and working one-on-one with patients, if this is what you like. So don't go into nursing for the money, for the lifestyle, because I know a lot of people, when I initially started working, they're like, you work 3 days on and have 4 days off. But no, not really, because your first day is spent trying to figure out what was happening throughout the entire week, and your other 2 days you're trying to get your life back together. So I would say you need to be true to yourself and know, is this what I like? So having a genuine love for caring for patients, for knowing that when you see people, they may not be at their best. They're probably not at their best. They're at the hospital. So they're not necessarily going to be the nicest people around, but still trying to put that best foot forward and treat them just like you want your family member to be treated or yourself to be treated while you're in the hospital, and help them as best as you can. Also being flexible, day to day, nothing is guaranteed in my workload. I do have what I normally do and some type of things that we do the same, but you never know what type of patient you can get. They can be fine 1 minute and be crashing and decompensating another. So being flexible to what's going on, even a new job assignment, if they put you somewhere, and learning how to speak up and being flexible, never accept an assignment that you know you're not prepared for or that you can do or feel comfortable with. So a key thing that I've learned is being confident in what I know and knowing when to say, hey, can you show me this again? Willingness to ask questions I don't understand, and knowing that asking questions does not make you look dumb or some type of failure. We don't come into this world knowing everything, and as a nurse, no matter how many years we're in it, we don't know everything. So being able to be confident enough to ask questions and be like, I really don't know, can you explain? That's really helped. And having enthusiasm for going to work and loving what we do and wanting to collaborate with the whole care team throughout the hospital, because it's not just nurses in a silo. We're constantly collaborating and working with everybody, between the patient's family to social workers, case management, pharmacy, PT, OT, everybody. We're all working together. So it's important that we maintain that collective effort and realize that it's nobody above or below each other, but we're working as a team to get these patients together and to get these patients better and hopefully out the hospital.
For physical therapy, you really have to be a people person. You have to talk for 45 minutes to an hour throughout a whole session. So you don't have to be necessarily extroverted, but it does help. And willing to spend that amount of time with patients. I know with other providers or other fields, sometimes, like if you see a doctor, you're going to spend not too much time with them. So just knowing that you are expected to spend 45 minutes to an hour with them, and doing that for an 8-hour day, like you need to have the energy for that. Also, if you're not willing to help people, then you probably shouldn't be in the healthcare field. So that's really necessary as well. And just like what Alexandra said, you have to be flexible and adaptable, because there's always new research coming out about new treatments and how old treatments don't actually work. So understanding how to change your practice and grow, being willing to grow. If you're not willing to grow and you're trying to do the same thing with everybody throughout your whole career, then it's probably not going to work out for you eventually.
Yeah, all great things that I've heard. I would say willing to help, willing to learn. I would say detail oriented is something that I definitely think all pharmacists should be, as well as questioning. Questioning to make sure, is this the right medication? Is this the right dose? Is this the right time? Those should be the questions that are constantly going through your mind whenever you're reviewing an order, you're talking to a patient about their medication. I would not just follow whatever is written all the time. That's why you went to school, is we're all double checking each other, from physical therapy to nursing to medicine to pharmacy. And so a big thing that I try to teach my learners that are on rotation with me is, you are the last line. That's one thing, that's one, I guess, famous line that I always say: pharmacy is the last line before the patient gets the medication. So nobody wants to hear, when somebody was on the wrong anticoagulant dose and they bled out. Nobody wants to hear, oh, well, the doctor wrote it, or, oh, well, the nurse gave it. The pharmacist is there to make sure that, that medication doesn't go out if it's not appropriate. So you really have to, know your limits, take a break, stop and think, is this appropriate? Or is anything missing? That's a lot of times, is anything missing? Are they on duplicate medications? Why do we have 2 cholesterol medications? That's not something we normally see. Why, if the patient's vital signs, their blood pressure is low, why would we be giving them, this particular dose or this medication? So always questioning, does it make sense? Is a big thing. Being very detail oriented and always double checking if you're not sure.
Yeah, I agree with the being detail oriented as well, because I think a lot of the times people think physical therapists are just like getting people up and sitting them back down. But if they're coming and they don't have an order from a doctor, then you really have to keep your eye out, because some pains can actually be something vital or organ related. So you really have to know the medical side as well. And especially PTs in the hospital, they have to make sure they're appropriate to be seen and make sure they're not going to pass out on you while you're trying to walk them or something. And also, like, pharmacy is hard. There's a pharmacy class that I had to take in PT school, and there's just so many medications, but just understanding generally as a PT, what medications do what common medications do what is really important, because sometimes you can't treat them if they're on a certain medication. So.
Kudos to you, kudos to physical therapy, because one thing that has been really motivating for me in this role is I never had interacted with a physical therapist before up until the last 4 or 5 years. And you guys are great. I hear the things that you're talking about. And I will say that our patients, especially our liver transplant patients that are very sick, usually people who either had, just autoimmune liver disease or, possibly damaged their livers through alcohol. These people are super sick. The liver transplant saved their life, but they are so debilitated. And what what physical therapy does to get them to the point that they can safely get home, and, just listening to your assessments on, whether or not this person needs additional rehab or they're safe to go home. And I just hearing you guys talk about sitting to standing and just the equipment that they need at home. It's a lot that's entailed in what you do. And so that's one of the things that I'm thankful for is in this position, the fact that I get to interact with so many disciplines, but then also throughout school, just we had a lot of interprofessional education days, which I think was super cool because you got an idea of it's not just about your discipline. The care of a patient is all encompassing. It really requires all professions for a patient to be successful.
Yeah, totally agree.
Okay, thanks so much. I know this... Oh, go ahead.
Sorry. No, that
No,
detail
go ahead,
oriented
Alexandra.
There's oftentimes when you do see orders from anyone and you have to question on, is this correct? Am I putting the right medication in the IV? Because once it hits the patient, you can't just say, oops, and never mind. You really do have to pay attention. So no matter what you're doing, truly keep honing into all the details that are happening within the procedure or just within your day.
So this may be a slightly difficult question in that I'm sure there is no typical day or typical week, but as much as you can, describe a typical day or week and what that would look like for you.
A typical day for me. So I have a staggered schedule. I don't have an 8 to 5. So on Mondays, I go in from 6 a.m. I work 10-hour days, so I work 4 days a week. But yeah, I go in, I look at my schedule, I prepare the notes because a lot of healthcare is about documentation and making sure you write down everything you do. Then I see my patients, and then I try to get all my documentation down. But I'd say a typical physical therapy visit is talk to your patient, see what's going on, then do some testing, then you give them treatment, and then you give them a plan of care. And then if they're coming for a follow-up, then you do your treatment, you do your exercises, and then they go back home. And then by the end of the day, you're just finishing up documentation. And yeah, that's about it. I have team meetings once a month. So that changes things up sometimes. But yeah, outpatient is not pretty routine, but in terms of the cases that we see, that's not routine, but that's a typical week.
I'm currently still on orientation in the cath lab, so my day changes depending on what person I'm shadowing. So currently I'm in the circulating role, so I wake up and I'm working 8-hour shifts. So my time usually working is 7 to 3:30 or 8 to 4:30, depending on how many cases we have for the day and how early we need to come in. So a typical day, it could depend on the surgeon. Some people like to schedule 20 to 25 cases in one day. Others will schedule 4 or 5. So just learning how to adapt and still pace myself and taking those breaks in between the cases and not just trying to run through all of them for 4 or 5 hours straight. Right now, as a circulator, my role is to listen to what's going on with the procedures during the procedures and give the physicians and the scrubber, the person who's next to the physician, all the materials they need. So that's whether it's medication for the patient, different items that we're going to be putting into the patient. So balloons that open up the artery or stents that keep it open, whatever they need, I'm bringing it. And on top of that, I'm also managing the patient because I'm the only person who's able to touch everything and be in that environment where I don't have to be sterile, meaning that I don't have to be gowned up. So if my patient starts decompensating, low blood pressure, low heart rate, I have to fix that. That's my role to figure out what medication they need and ask the physician, what do they need? Let me give it. Next week, I start my new role and I'll be scrubbing, which means you're next to the physician directly and actually putting the stents in, helping him, assisting him, and collaborating with him to open up the arteries, moving things around in the patient. So that'll be an interesting role. And the last one is monitoring, where you're clicking what's going on in the procedure outside and you're letting the paperwork kind of fill up and letting everybody else know what's going on and what you did step by step. So a typical day is fulfilling one of those roles and then going home in the evening. We're also on call on specific days. So right now I'm on call week by week. So if I leave here at 4:30 and someone has a heart attack at 6, I'm back here and we do the case and then go home. So on call can be a lot at times because you could be working and then going home and then you're coming right back, or you just have back-to-back emergency patients. And the emergency patients are way different from just our typical everyday patients that we get. These are people critical, about to crash, near life and death, that you have to think fast on your feet. So they call me at 1:15 in the morning. I need to be just on point as I am at 9 o'clock in the morning. So different role, but I do like what I do and I enjoy waking up and coming to work every morning. Definitely need my breaks and my self-care vacation time, but I do enjoy what I do.
That is awesome. I would say for me in my role, I have a pretty set schedule for the most part. My days are Monday through Friday, usually 7:30 to 4 or 8 to 4:30. Kind of given the flexibility to sort of, tweak my schedule as I need to. But usually in the morning, I'll come in and I usually do a review of all of my transplant patients on their initial transplant admissions. So we have a lot of readmitted patients for whatever reasons, complications, high potassium, rejection, different infections that might be readmitted to the hospital. But for the most part, my focus is those new patients, making sure that we've identified any barriers like insurance prior authorizations, or if we need to try to help get their medications be a little more affordable, or making sure that their regimens are complete on the inpatient and on the outpatient side. So I kind of have, I guess, what's more of like an ambulatory role, just bridging that gap of them being admitted to the hospital to be safely discharged from the hospital. So my mornings, I usually will try to come in a little earlier, usually about like 7 or so. And then I'll kind of like work up my patients. I might have a couple administrative meetings and Then we always have patient care rounds at 11 o'clock. It's usually about, for us, it's not the rounding that a lot of inpatient teams do, since it's more ambulatory focused. It's usually about an hour long. We used to do them in person. Given COVID, it's now via Zoom call. So we're talking through all the patients, any barriers. I'm focusing on all of the medications. I'm focusing on patient education needs. So I am one of the 2 transplant clinical coordinator pharmacists. So that means that out of the entire hospital, we're the 2 that are focused on making sure that all of those patients are educated and all the medications are going to be ready to go before they get discharged. My afternoons are usually more direct patient care focused in terms of talking to patients, as well as working with providers to get patients safely discharged from the hospital. So pre-COVID, I was at the hospital every single weekday, Monday through Friday. And I would, go into patients' rooms. I had my dress shirt on, ties, slacks, dressed to the nines, and I had my white coat. Well, with COVID and us pulling out of the patient rooms, I now wear scrubs to work. So I actually just changed before I got on the Zoom call. And my partner and I, in efforts to minimize and mitigate possible exposure to COVID, we're actually rotating. So sometimes I'm here at home in my office, at other times I am physically at the hospital. But either way, we're making sure that, as a combined effort, we're doing everything that we can to make sure that all the patients are taken care of each day. And I know Alexandra mentioned on call. I am on call, want to say every couple months, actually. That recently changed for me. And that's one of the great pieces or points of quality of life, which makes me really glad that I did the residency. I used to have to staff in the pharmacies. In addition to my Monday through Friday job, I used to have to staff every 3rd weekend. I now have to be on call every 12th weekend. So that usually entails working an assigned shift remotely for 8 hours over the weekend. And then on that same weekend, from Friday at 6 to Monday at 8 a.m., any specialty pharmacy issues, I'm the 1-point person for the health system to address. So if that's a patient that has a concern about their hepatitis C medication, we have fertility patients that want to start therapy, inflammatory conditions, migraine medications. You guys have probably seen a lot of commercials about those. If you know anyone or you have a medication that is filled through our Hopkins pharmacies, you might end up speaking to me at some point if there's an issue over the weekend and on call. So that's been another thing that has kind of been in my new routine, participating in that and being exposed to some of those other disease states and medications.
Thank you so much for sharing a little bit about your routines and what could be, or maybe sometimes isn't, a typical day or week. I know that we're just after 6 o'clock. I do have one final question. It might be a little specific and it is a little different because it's someone thinking about PA school, but we'll answer this question and then kind of wrap up. And for those that haven't registered yet, students, I'm going to put that link into the chat again, if you wouldn't mind, if you haven't already, going to that link and just registering that you were here. And we'll do that in a moment. But the question is, someone wants to apply to PA school and they got their CNA certification, but they're a little leery about working a lot because it would be in nursing homes, which are a little bit more dangerous right now. This person said in the state of Maryland, they know that you don't need a certification to work as a medical assistant, but a lot of job listings online do require one. So as much as you know, or if you don't know, you can say that too. How would you recommend this student maybe go about finding a medical assistant job or CNA work specifically in a hospital setting, if you have any knowledge in that area?
I believe for PA school, it doesn't matter what type of hours they are, as long as it's direct patient care. So I know this is not a hospital setting, but I know you could do volunteer or work a paid internship at a PT clinic, outpatient or inpatient. You can try doing EMT, which is a little bit dangerous too, and does require some certification, I believe. And I think you could also do pharmacy tech, which is also not the hospital, but their hours. So actually, I'm actually not too sure about pharmacy tech because I don't know if it's direct patient care. So.
It seems relatively easy to get a CNA position throughout the hospitals. I can say your exposure to COVID kind of depends on what unit that you're on. My unit, we're not allowed to have COVID patients at all, so very rare. And when we do, it's super isolated and we're all have extra protection. Now it seems like we're getting better with the whole mask situation, so I hope it stays that way. But in terms of getting experience, I think to find a nursing assistant job, whether it is in the hospital or the nursing home, should be a straightforward process to address your concerns on the safety within the nursing homes. I honestly don't know. It's hard because you're with you're with a group of people, and stuff potentially has a risk of spreading quickly. However, people who I know who are working in nursing homes are getting tested like every week, and we've been more frequent on our testing in our own facility. So now that people somewhat have COVID under wraps and kind of know how to handle it, it seems like there are more standards and precautions being put in place. So I guess I would suggest that wherever you do apply, you can ask that question up front. And if it doesn't fit your criteria or what you hope in the safety and protection of yourself, then you can kind of move forward and shift and figure out a different place to reach out to.
Wonderful. Thank you so much. I appreciate our panelists' time and energy and great answers. I'm sharing the screen now. If anyone has follow-up questions or concerns, Lauren's email is on here. She's our program director with the School of Public Health. I'm the program director for Computer, Mathematical, and Natural Sciences. So if there are follow-up questions, concerns, please feel free to reach out to either of us. Lauren, do you have any final words?
Just to thank you again to our panelists. It was really great. I feel like I learned a lot as well as just, really enjoy bringing, some of our alumni back and hearing, what you've gone on to accomplish. And thanks to our students too for showing up today. And don't forget to click that link and just make sure that you register to let us know that you were here.
Thank you for having us. This was great. I miss Maryland.
You guys were great. We'll come back and visit anytime. Awesome. Thank you so much. We appreciate your time and not even getting to go home, Alexandra.
Soon.
For those that don't know, Alexandra emailed me earlier today and said, I'm done right at 4:30. I'll be on by 4:45. And she was ready to go. She heard her tripod. She was dedicated.
Yeah, that's awesome.
Anything for the term.
You're all dedicated. I was just impressed. She's still at work.
Impressed too.
All
right.
That is all we have. If you want to sign off, you are welcome to do so now. Thanks so much, guys.
Thank you. Feel free to contact me guys if you have any questions. Will you be giving us our email addresses?
Yeah, you could definitely give mine out too. That's fine.
Oh, perfect. Okay, great. So if anyone has questions and they send to us, I will just pass your email along to them to reach out. Thank you so much.
I know it helps to network however I can be of assistance.
Love it. Thanks so much.
Thank you.
Absolutely. Take care.
Have a great evening. Bye.
Thank you.
Bye.